Prostate cancer is one of the most common cancers affecting men, especially those over the age of 50. And while it usually grows slowly, that doesn't mean it should be taken lightly. So what actually happens inside a man's body when prostate cancer develops? And more importantly, how can it be caught early before it causes serious damage? The prostate is a small, walnut-sized gland located just below the bladder. It's part of the male reproductive system and helps produce semen. When cells in the prostate begin to grow uncontrollably, cancer can form. In the early stages, prostate cancer might not cause any symptoms at all. That's why many men don't even know they have it until it's found through routine screening. As the cancer progresses, it can lead to changes in the body that are easy to overlook. One of the first signs some men notice is difficulty urinating, like a weak stream, trouble starting or stopping, or the need to go more often, especially at night. That's because the growing tumor can press against the urethra, narrowing the passage that urine flows through. Some may also experience blood in their urine or semen, or pain in the lower back, hips, or pelvis if the cancer spreads beyond the prostate. Inside the body, things are changing at the cellular level. The immune system may become more active, trying to fight off abnormal cells. Hormone levels, particularly testosterone, can also play a role, since prostate cancer cells often rely on androgens to grow. In more advanced cases, prostate cancer can spread to nearby tissues, lymph nodes, or even bones, causing fatigue, weight loss, or pain that doesn't go away. When caught early, prostate cancer is highly treatable. In fact, many men diagnosed in the early stages live long, healthy lives. That's why screening is so important. A simple blood test called the PSA test, short for prostate-specific antigen, can detect high levels of a protein made by the prostate. If levels are elevated, it could be a sign of cancer or another prostate issue. Doctors may also perform a digital rectal exam, DRE, to feel for abnormalities. Newer screening tools are also being developed, including MRI scans and more advanced blood tests that help doctors better assess risk before recommending a biopsy. And when it comes to treatment, options range from active surveillance for slow-growing cancers to surgery, radiation therapy, and hormone treatments. There have even been breakthroughs in immunotherapy and targeted drugs for more aggressive or advanced cases. It's also worth noting that several high-profile figures, like former President Joe Biden, have brought more awareness to prostate health. When public figures speak up about screening or treatment, it helps break the silence that often surrounds men's health issues. Biden was diagnosed with an aggressive form of prostate cancer after experiencing urinary symptoms. According to the Associated Press, a physical exam led to further testing and a biopsy, which confirmed the diagnosis. However, the cancer had already spread to his bones by the time it was detected. What's especially important to know is that his last PSA screening was back in 2014, over a decade earlier. This gap in routine screening likely contributed to the cancer being caught at an advanced stage, rather than early when treatment is more effective. His story is a sobering reminder that prostate cancer can go unnoticed for years, and why regular checkups, especially PSA screenings for men over 50 or with a family history, are absolutely critical. Biden's public disclosure has helped reduce stigma and encourage more men to take prostate health seriously. Other notable names have shared their journeys too. Robert De Niro, the award-winning actor, was diagnosed with prostate cancer in 2003 at age 60. The cancer was caught early during a routine checkup, and he underwent successful surgery. He's been in good health ever since. His story shows that with regular screenings and timely treatment, even a serious diagnosis like prostate cancer can have a hopeful outcome. Colin Powell, the former U.S. Secretary of State, was also diagnosed with prostate cancer in 2003. While he faced other health complications later in life, he openly discussed his experience with the disease, helping to reduce the stigma around it. And then there's Ben Stiller, the actor and comedian, who brought prostate cancer into the spotlight in 2016 when he publicly shared his diagnosis at age 48. What made his case particularly striking is that he had no symptoms at all. It was a routine PSA, prostate-specific antigen blood test, something not typically recommended for men under 50 that ended up detecting his cancer early. Stiller later said in interviews that if he hadn't taken that test, his cancer might not have been found in time. He called the PSA test the only reason I'm alive right now. Stiller's story reignited public discussion about the age at which prostate screening should begin, especially for men with a family history or other risk factors. While guidelines vary, his experience highlighted how a personalized approach to screening, based on age, health history, and risk level, can be life-saving. Stories like Stiller's, and others like Robert De Niro and even President Joe Biden, do more than inform. They destigmatize cancer screenings and encourage more men to get proactive about their health. According to the American Cancer Society, about 1 in 8 men will be diagnosed with prostate cancer in their lifetime, but early detection significantly improves survival rates. When public figures speak openly about their experiences, it reminds men that taking charge of their health isn't just okay, it's smart. So, if you've been diagnosed with prostate cancer, or maybe you're just being proactive about your health. Either way, the big question is, what can you actually do to protect your body and improve your outcome? Let's break it down. First, start with your doctor. If you're over 50 or over 45 with a family history, don't wait for symptoms. Talk to your doctor about getting a PSA test, which measures prostate-specific antigen in your blood. It's a simple test, and while it's not perfect, it's still one of the best tools we have for early detection. But here's the exciting part. Screening and diagnosis have come a long way. Today, doctors can use multi-parametric MRI scans to get a better look at the prostate before doing a biopsy. This helps avoid unnecessary procedures and focuses on the areas that actually need attention. There are also genomic tests now that analyze the DNA of your cancer cells to see how aggressive they are. This helps doctors decide whether to monitor it with active surveillance or move forward with treatment. It's personalized care, and that means better results. Now, if treatment is needed, there are options. Surgery and radiation are still common, but newer approaches, like focal therapy, which targets only the cancerous part of the prostate, are gaining ground. For more aggressive cancers, hormone therapy may be used to block the testosterone that fuels tumor growth. And yes, chemotherapy is sometimes used, especially in advanced cases, but it's usually not the first line of treatment for early-stage prostate cancer. Some patients are also exploring immunotherapy and targeted drug therapies, especially in clinical trials. These treatments are designed to help your own immune system fight the cancer more effectively, and researchers are seeing some promising results. But medical treatment is only part of the picture. You can support your recovery and overall health through lifestyle changes too. Here's what really helps. Eat smart. Focus on a diet rich in cruciferous vegetables like broccoli and cauliflower, along with tomatoes, berries, and foods rich in omega-3s like salmon or flax seeds. These help lower inflammation and may slow cancer progression. Move more. Regular physical activity, even walking 30 minutes a day, can improve energy, mood, and immune function. Studies have shown that exercise may even help slow the growth of prostate cancer. Watch your weight. Obesity is linked to more aggressive prostate cancer, so maintaining a healthy weight is one of the best things you can do. Manage stress. A cancer diagnosis is a lot to take in. Mindfulness, prayer, counseling, or support groups can help you stay emotionally balanced and mentally strong. Limit alcohol and avoid smoking if you haven't quit already. Both are known to increase inflammation and can make it harder for your body to heal. And finally, stay engaged. Keep asking questions, stay on top of your checkups, and lean on your healthcare team. You don't have to do this alone. Prostate cancer can be scary, but with early detection, modern treatment options, and healthy daily habits, many men live long, active lives after diagnosis. If this video helped you, give it a thumbs up and share it with someone who might need it too. Don't forget to subscribe and hit the notification bell so you can be the first to know when our latest video comes up. Got a question or a story to share? Drop it in the comments. We'd love to hear from you. And if you'd like to support the channel, check out our merch store or leave a super thanks. It really helps us keep making helpful videos like this one. Thanks for watching. Take care, stay healthy, and we'll see you in the next one.